the CEO of the Amber Clinic.
Thank you. Thank you so much. No, but the first two talks very informative. I really enjoyed this one.
We are hard pressed for time.
I think, yeah, we don't really know the time.
Thank you. So it's my task to give conclusive remarks. No,
Difficult job.
actually, those perfect presentations do not need conclusive remarks. I could only make it worse, not better. I would like to thank you very much. It was heartwarming to see all your compassion and your dedication to the topic and the way you presented. Actually, psoriasis in 3 hours. I learned a lot. I enjoyed a lot.
Thank you.
Now, while I do not need to give you conclusive remarks, I have a lot to think about. Now, I want to share, I am Group CEO of Gulf Healthcare International. And we have standalone labs, we have our Amber clinics, and we have occupational health. When I joined 4 years ago, I asked all my doctors and nurses to come together and I asked them one question. How do we want to provide healthcare together? And I must say I was very proud of my staff. Because what they said in a nutshell was a long meeting, but what they said in a nutshell is, Doctor, we want to provide more service than we can expect from a pizza delivery. You order a pizza, you get the pizza, you pay, thank you, goodbye. My doctors, my nurses said we do not want to treat symptoms. We want to take care of our patients because we are primary care centers and we want to take this literally. I was very, very happy about this. And since this time, we continuously work on this goal. Now, when I see today's meetings, there was not one presentation where it was not mentioned that education is core, right? Vast majority of primary care diseases are chronic diseases, right? Diabetes, hypertension, asthma, psoriasis, hypertension, I missed one, hyperlipidemia. We cover about 75% of primary care spectrum. Chronic disease is always linked with an impact of life quality. And the major reason why life quality is impacted is being fear, uncertainty, not knowing what will happen, not knowing what to do. Education is core. Now we live in a system that makes deploying healthcare more and more difficult because insurance companies want to cover less and less services. And frequently when we developed our own model of care, my physician said, that's not covered, it's not covered, it's not covered. It was our approach, and I think that makes us very special and different to other private healthcare providers that do not focus on what is covered, what is not covered, focus on what is the patient need, because on the long run, we will get the best success, the best outcome. We will have loyal patients and the patients will stay with us. This is what Sri Kumar, Abdul Karim and Nurse Hida, they are our leads in the program development. Thank you very much for your continued support and also for your success. Congratulations. Now, when I was so easy to say, let's focus on the patient need and not on the insurance coverage, this would not be possible without the industry. And there Novartis comes in, and you sponsored today's meeting as well. And we cannot thank you enough, because this is exactly the approach that Novartis and other leading companies had to invest into education, also for the same reasons. And really thank you. This makes our work possible and our approach possible. Thank you very much. It needs an applause. Then also, thank you very much. You are the leader of the patient self-care group for psoriasis. And I know from Dr. Sri Kumar how much work you do and how much easier his responsibility is based on your work. We really take it seriously to treat the patient, to take care of the patient, and this is why you will be sometimes surprised, and I heard it, you come with a skin alteration and the doctor asks you whether you already had an ophthalmologist to watch the retina, or go to a cardiologist, or do this or do that. And this is based on our approach. Now, last but not least, I congratulate the attendees because you made a good decision. Because actually, you see from the doctor side, very free of any dependence. You get informed in a very, very easy way so that the layman understands what is the nature of your disease, what can you expect, what do you need to care of, and be sure you can have a good life, even though you have a diagnosis that is a chronic diagnosis and you may not like to have it. But still, we heard it in each of the presentations. You have responsibility for the course of your own disease to a very high extent. All we can do is to support and facilitate. It's up to you to do. Anyway, your choice coming here is a good one, and I wish you all the best for your further course of the disease. So did I forget something to say?
No, not enough.
Covered everyone.
Thank you very much and have a good day.
Can we take a group photograph?
Sure.
Please.